sense guy. I'm not someone who gives real complex things. I always tease people, I said, we take something that can be accomplished, then we make it so complex we can't execute it. And that's when we stop. So I want you to walk out with two things today that I hope will serve you well. Number one is how to maximize your own appointment with a doctor or when you go to a hospital. How to truly control your health, and I'm not talking like Dr. Schneider about exercise, though it's important. I'm not going to talk about eating right, though it's important. I'm not going to talk about the right supplements and vitamins based on your blood type and your body and those types of things and all those things. Those are all vital. I'm talking about when you go to the hospital or go to a doctor, how to maximize that appointment. How for you to control it versus somebody else to control it. So that's going to be the first half. The second half is how are you to know when you go to a hospital, we're going to talk about hospitals tonight, but we give you a lot of other information, but in this time zone, that they're any good. How to make sure the quality is the quality that you want. How do you know that that hospital is the one that's going to get you to the catheterization in the right amount of time, which has a big impact? How do you know that that's the hospital that's got the best chance of you getting an aspirin with an acute MI, which is a huge, huge indicator of your clinical outcome? Because some are better than others. Now, 10, 15 years ago, we didn't know that. Today, through Medicare and through data collection, you can go on and by hospital, find out exactly how good they are clinically and how good they are at things like managing pain, how clean they are, how well they respond and answer your questions. So I'm going to provide you a website where you can go find that information out. And I'm going to show you Sacred Heart, Baptist, and West Florida. And I'm not going to put the name on them, but I'm going to show you their results and how they compare. And I could put others like Gulf Breeze and Santa Rosa. I did those three. Because I think if you're really interested, you can go to their website and do a little homework. And I would do homework. I really would. It's pretty interesting. I don't know about you, but my wife and I like movies. I don't think we ever go to a movie without reading a review. We never go out to a movie without reading a review. Yeah, you buy any product, we go to Consumer Report, and we read Consumer's Report. We go to a restaurant, we look at reviews and all sorts of things. We go to that restaurant, and we go to a hospital, I hope they're good. You know, they should be good. They're a hospital, aren't they? And so I really want you to be able to make your own decision. I'm not here to say one over the other. I want you to be able to make your own decision. Also, on the information I will show you, no matter where you are, you will be able to find that out. No matter what city you're in, no matter where you are in the United States, you will be able to say, this is the place I think we should go. This is the place the odds are pretty good that I'm going to get the very best care. So let me walk you through the beginning, which is going to be our own care, and then we're going to walk you through how to pick quality care is what we talked about. So that's what I want you to get out of this. Be a better consumer of your own health when you go in for an appointment, and also learn more about the quality of care of a particular organization. This was in the paper about a week ago. We're very fortunate. We don't do a lot of local work at all, but we do a lot of national work. We do a lot of work in Canada. In fact, 1 in every 7 emergency room patients in the United States will be treated in a hospital today that works and uses our services. One of those is the University Medical Center in Tucson. In fact, when I do my national talks, I've always used them as an example of a hospital that we've had really good success with before this terrible tragedy. And when this tragedy occurred, in fact, we had staff there just last week for 2 days. Something hit me that I thought was interesting. The first aid on site was tremendous. The ambulances and the paramedics and the 911 call just worked flawlessly. The patients were kept from going into shock, which is sometimes shock can kill as much as the injury. They were taken to a hospital. When you're in a hospital and you're getting a lot of patients all coming in at one time, how to triage and manage that is extremely difficult. They took flawless care of these individuals. They saved lives that might have died somewhere else. Yet we heard a lot of doctors reporting on the condition, but we didn't hear a lot about the superb care that the patients got. Let me give you another scenario. What happens if the ambulance gets there a little late? What happens if they go to the emergency room, they're overwhelmed, so they go on something called bypass, which means you tell the emergency vehicle to go somewhere else? What happens if the trauma surgeons aren't available or not there to get there soon enough? They actually had a surgeon from Virginia that we actually work with Inova also, on his way, because he's a trauma surgeon, on his way to Arizona because they treated us in a military combat trauma situation. What I'm saying is they flawlessly handled it. And in our ad in the USA Today that we ran, we basically talked about what quiet heroes those healthcare workers were. But see, sometimes when it works right, we just don't notice it. Now, I'm not a big on baseball, but what I understand, it's sort of like an umpire, you know? If you notice the umpire, it's probably a bad thing. So maybe it's good that healthcare didn't get all that attention, but I really think they did a remarkable job. So we ran this in the United States. We're thanking the Pensacola News Journal for helping us do that, because they really did help us get it nationally. And we also took out a full-page ad in the Tucson paper. And when our staff was in Tucson this last week, last Thursday and Friday, she said they read this letter at every staff meeting and they sobbed. That everywhere you went, this letter was up. My message is we're going to talk about some flaws later in healthcare. But I don't want you to believe for a second that I don't think healthcare is not loaded with passionate people, because it is. I don't want you to think it's not loaded with skilled people, because it is. But what it is loaded with sometimes is some inconsistency. We have excellence in everything, sometimes just not every time and everywhere. And that's really why the Studer Group exists, to make sure we have excellence in everything, every time, and everywhere. So let's go into maximizing your doctor's appointment. I'm going to tell you what I think the best physicians do and the best medical centers do, and I'm going to assume you might not be getting it. So I'm also going to talk about, then let's not be a victim, what we can do to make those appointments work. One of the big things that we recommend is if you have any questions before you go to a doctor, if they don't call you or the hospital doesn't call you, you call them. What we do when we teach hospitals is to always call a patient before an appointment. It does a few things. Number one, it reduces anxiety because they can tell you exactly what you need to bring. Number two, they can go over directions. Anybody ever drive to a hospital and find parking a little difficult? And next thing you know, you're running late to your appointment and you don't want to be late. So now they wonder why your blood pressure is so high. Anyways, you're trying to find the right spot. And then you can't find a parking spot. I know when we work with large healthcare systems, we find if you can call the patient, let them know exactly what's going on, what to bring, what time to get there. I'll give you some statistics. No-shows go down by 70%, which is really good for all of us with healthcare cost. Tardies go down by 60%, but the patient's perception of care goes up 25%, because you bring the right medications, you know exactly why you're going, you know where to go, and the other key question to ask is, what's my copay going to be? Has anybody ever gone to walk out of a doctor's office and they tell you, here's the copay? Now, they all take credit cards today. We work with organizations, we actually tell them to collect the copay over the phone, because that way when you get there, you don't even have to worry about it. So if your doctor or your hospital's not calling you, call them. Let them know, what time should I be there again? I want to confirm the appointment. Where should I park? What should I bring? Is there a copay? Any questions you have about the test or procedure? We also found out some interesting things about when you get the call, and this is sort of for the people that call, colonoscopies. Some interesting data. Do you know women read the instructions for a colonoscopy earlier than a man reads the instructions for a colonoscopy? When do you think the guy starts reading the instructions for the colonoscopy? Oh, crud, shouldn't have ate that, huh? Well, I should have been fasting these last 6 hours, huh? Guess I can't go, can I? We gave everybody a copy of this. When we work with medical group practices, this is one of the things that we recommend that they give every patient when they come in. And what we find by that is called a patient visit guide, and you should have a sample of that. And you can copy it, do whatever you want with it. The reason we do a patient sample guide is because when people leave a doctor's office, they have questions. And the doctor's office very often will get a question of something they will cover. Or sometimes you might just miss what was said. My dad is an unbelievably tough consumer of healthcare. He's 90 years old. He never met a doctor's office. He didn't want to stop in and see him for a while. He makes an appointment, and then he goes in, and then he tells me he went to the doctor's office. And I'm sure none of you go through this. But when my dad turned about 84, somebody told him he could use the word hell in every sentence he says. So it's always, what the hell are we going there for? What the hell do they want? You know, something like that. And then, excuse the language, this is him. I'll call him up and I'll say, what did the doctor say? He's like, not a damn thing. They never tell you a damn thing. And he's unbelievable. And one day I called him up and I said, what are you doing? He goes, I'm going to the doctor. I know why I'm going there. I can't tell me a damn thing. I don't know what the hell I'm doing this for. I said, well, why don't you do your doctor a favor? Because they need a good day too. Why don't you call him up and tell him you're not coming in today? They are not going to go through remorse or depression because you ain't there. But then I called him one day, and he really had a different experience. And it was because they did something like this to him. He had a patient visit guide. And when he went through the visit, they asked him what was his primary reason for being there, and then he filled it out. It saves the doctor's time, the nurse's time, and your time. The key things are vital signs. When people call back to a hospital or a doctor, the thing they can't remember were their vital signs. So now you have the vital signs so you don't have to call back. He also gives them information. If you need to call, here's the best number to reach us at, or call us. We also talk about medication instructions. Did you make any medication changes, or don't you? To give you an example, 1 out of every 5 patients that leave a hospital in the United States today has an adverse event. An adverse event means something didn't go exactly the way it was supposed to go. 60% of those are medication issues. And it's many times because people just don't take the medications correctly because they don't understand the directions. My dad was in the hospital one time because he came home and thought the medications would go better on an empty stomach because they would work quicker. Then he was, of course, dehydrated and ended up having challenges. Other people think if I double up on the medication, this will work a little quicker. Or, my God, I'm doing so well, I think I can quit this medication right now. So that medication becomes a key element. Recommendations, before you leave today, here's what I want to make sure you do before you walk out of my door today. You go over the follow-up care, and then you very much cover some post-visit expectations. Now, if you bring into that in the office and you use that when you go through your doctor's appointment, you will have a better appointment. But they will have a better appointment also. Because you're also going to talk about questions you might have. What's the one thing we need to focus on to assure that you have a very good appointment today? Physicians implement this when we talk to them about it because it saves them time. It saves the patient calling back because they didn't hear or didn't understand something. So one of the things I want to do is give you some tools today so when you go to your doctor's visit, your office, you can make the most of it because the healthier we can get Pensacola, we all sort of win in this type of situation. And this will help healthcare providers, if they don't do it, adapt it because they'll see how it works.